A new report today from COVID-19 vaccine maker Pfizer shows the important role that booster shots play in protecting people from the Omicron variant of the virus.
Michelle DeSelms spoke with Dr. Ronald Grifka with the University of Michigan Health West about that study.
Thanks so much for being here. Good to see you again.
Thank you, Michelle. Great to be here, and hope you're well and surviving the cold weather and the pandemic.
Yeah, thanks. You too. Well, I mean, we got what seems like a bit of good news is that the Pfizer booster seems to have neutralized the Omicron variant.
Certainly. What we've seen, 2 doses of the Pfizer vaccine results in some maybe mild to moderate symptoms, but it does prevent against severe disease. But if you have had the 3rd shot, the booster, it does appear to be very effective against the Omicron variant.
Right. So those 2 shots are still very effective in making sure you don't get really sick.
Exactly. You might have some cold sniffles, fever, chills, and maybe some the taste and smell, obviously, but should keep you out of the hospital. But certainly, if you have the booster, you're going to be much healthier and may not get any symptoms at all. It's so very minor. And, we've just seen Omicron for the last really 2 weeks or so. We're just learning more about it. But the more we learn about it, it does seem that the Pfizer vaccine is effective, thank goodness.
Yeah, that is really good to encourage everybody then to get that booster. Do you think we'll need a booster every year?
No, there's actually some talk now, will you need a booster a year after the 3rd shot? And maybe it's going to be similar to the influenza virus. Every year you need a shot. Then again, maybe it'll be like tetanus. It's every 5 to 10 years. So time will tell. Obviously, this coronavirus hasn't exactly followed any historical values from other viruses. So it is a little different. We've had a difficult time predicting what it's going to do. And certainly we do know that the more people get vaccinated, the less variants, the sooner we'll get through this pandemic.
Yeah.
It is encouraging to see that I think in the last week in the United States, there were almost 13 million doses of vaccine given. I think 7 million were boosters. So I think maybe people are starting to realize that if you haven't been vaccinated, you need to do so. And if you had had the vaccine, we need to get the booster shot.
Get your flu shot too.
Yeah, exactly. Mm-hmm. So we haven't seen too much flu yet, but certainly if we do get a big flu surge on top of what we have now with COVID, we're already overwhelmed with COVID, but that could throw us over the top.
Yeah, sure could. How are you guys holding up?
The hospital is very full. Roughly half of our inpatient census is COVID. We're really getting hit very hard, and patients are staying in the hospital for a long period of time. And if they've not been vaccinated, which is 90% of them or so, they've developed some very severe disease, and it's really taken a toll on a lot of patients.
Right, and the staff as well, I would imagine, not just physically exhausted, but they must be just mentally exhausted. It's been going on for so long.
No, mentally and emotionally. I mean, it's taking care of patients. A lot of people go into medicine to get people better, and you see people with COVID staying ill, and then sometimes not even surviving. But it's taken quite an emotional toll on all the healthcare workers, the nurses, the therapists, assistants, physicians. I mean, really, it's been going for a long time, and the severity of the illness really has taken, as you said, a physical, emotional toll on everybody.
Yeah. Well, we certainly appreciate everything you and everyone at U of M Health West are doing. Thank you so much.
Thank you. Be well.
You too.